Tonight's event is a collaboration between the chapter's leadership and social action committees. As you saw in the video montage before this program, we are deeply committed to uplifting and supporting our community through a variety of service initiatives. Tonight is yet another opportunity to fulfill that mission. We are gathered here for an important and timely and virtual conversation during what has been a challenging season for many of our fellow citizens. The recent and ongoing shutdown of several federal agencies has deeply affected thousands of Maryland residents, particularly federal employees, many of whom live right here in Baltimore County. Beyond the shutdown, our community is also grappling with the effects of federal policy changes, including job losses tied to reductions in the federal workforce, cuts to Medicare and public health funding, changes to vaccine policy and access, reduced environmental protections for the Chesapeake Bay and surrounding communities, and immigration rules that have placed stress on many families right here in Maryland. Tonight's discussion is designed to shed light on these pressing issues, provide resources, and to offer support as we navigate this difficult time together. But first, we will have opening remarks from the president of Upsilon, Epsilon, Omega chapter of Alpha Kappa Alpha Sorority Incorporated, Dr. Nakia Showell Bart. Dr. Showell Bart?
Yes, thank you. Thank you so much, Ms. Ball. And good evening, everyone. My name is Dr. Nakia Showell Bart, the president of the Alpha Kappa Alpha Sorority Incorporated, Upsilon Epsilon Omega chapter, proudly serving Baltimore County for over 31 years. Tonight's event, an intentional collaboration between our AKA Connection and Social Action and Leadership Committees, centers on a critical dialogue about the actionable steps we can take in response to today's challenging climate. We are truly privileged to be joined by an esteemed panel of experts in advocacy and policy who will share their invaluable insights and wisdom. We extend our deepest gratitude to each of them for their time and contributions. I also want to express sincere appreciation to our Leadership Committee Chairman, Ms. Sharon Ball, who you just heard from, and our AKA Connection and Social Action Lead and tonight's moderator, Ms. Kendra Brown. I also want to extend thanks to our first Vice President and Program Chairman, Ms. Jeroma Void, as well as all UEO members whose dedication and hard work made this evening possible. Finally, thank you to everyone joining us tonight. We invite you to engage fully and participate in what promises to be a meaningful and thought-provoking conversation. Thank you.
Thank you, Dr. Showell Bart. So, as she indicated, our moderator for this evening is Ms. Kendra Brown. Kendra currently holds the role of Vice President, Community and Belonging for MasterCard. Let me come on camera. She is the immediate past chair of the Maryland State Advisory Committee of the U.S. Civil Rights Commission. Previously, she was the Chief of Staff for Representative G.K. Butterfield, 1st District of North Carolina, in the United States Congress and Policy Director of the Congressional Black Caucus. Kendra is committed to community engagement and empowerment and is the immediate past president of the Upsilon Epsilon Omega chapter of Alpha Kappa Alpha Sorority Incorporated in Baltimore County and is a member of the Baltimore chapter of the Lynx Incorporated and Jack and Jill of America. She is a member of the board of Vermont Law and Graduate School, the Y of Central Maryland, and the Public Affairs Council and Maryland Humanities. At the regional level of Alpha Kappa Alpha Sorority, she currently serves as the Dean of the Ruth C. Easley Graduate Leadership Training Institute. Kendra loves her family and is a proud mother of Brooklyn. Kendra lives by the following creed: make a difference in the lives of as many as you can, as often as you can. And now, Ms. Brown, we turn it over to you.
Thank you so much, Ms. Ball. We truly appreciate you and your leadership of our leadership committee. Good evening, everyone. It's a pleasure to be with you this evening. I am looking forward to moderating a wonderful panel of experts, really sharing key information with us for this evening. And I'm going to very briefly introduce our panelists, very briefly, and then we're going to have a message from Congressman Johnny Olszewski. So tonight we have with us Councilman Julian Jones, who serves right here in Baltimore County. He was a division chief in the Anne Arundel County Fire Department with 29 years of service. He, of course, is a community leader, former PTA president of Hernwood Elementary School, a member of the Caucus of the African American Leaders, and a two-term member of the Baltimore County Democratic Central Committee. He was elected to the County Council in 2014. So we appreciate him for being with us this evening. We also have Ms. Holly Holliday, who you will hear from. She currently serves as the president of Sisters Lead, Sisters Vote, a 501c4 organization founded by Black women to elevate the political voice and leadership of Black women. You will see her often on Sunday calls with Win with Black Women. And I will just share that she is a member of the Rho Mu Omega chapter, and she serves as the Washington Connection and Social Action chair for the North Atlantic region of Alpha Kappa Alpha Sorority Incorporated. We also have Dr. Katrina Debnam. She is an associate professor of education in the Research, Statistics, and Evaluation School of Education and Human Development at the University of Virginia. She holds a joint appointment in the School of Nursing at UVA and an adjunct appointment in the Department of Mental Health at Johns Hopkins School of Public Health. She is a public health expert, and we are so grateful to have her with us this evening to talk about mental health, our young people, and public health. We also have Delegate Jennifer White Holland, who is a member of Upsilon, Epsilon, Omega. She represents the 10th Legislative District in Baltimore County. She was elected to serve in the Maryland House of Delegates in 2022. An experienced public health professional, she serves on the House Health and Government Operations Committee, Public Health and Minority Health Disparities in Health Occupations and Long-Term Care subcommittees. And she's also a new mom. So we are so grateful for her being with us this evening. We also have our final speaker is Senator Shelley Hettleman. She has represented the residents of Baltimore County, District 11, since 2014, when she was first elected and served in the House of Delegates for 5 years. In 2020, when there was a midterm opening in the Senate, she was appointed to fill the remainder of the term, and in 2022 was elected to represent District 11 in the Senate. She serves on the Budget and Taxation Committee, where she is chair of the Pension Subcommittee. She serves in a number of ways, and we're so grateful for her being on with us this evening also. And as I shared, we are going to have first, before we delve into our conversation, a welcome greeting from our very own representative, Congressman Johnny Olszewski, who represents the 2nd Congressional District in the state of Maryland.
Good evening, everyone. Congressman Johnny Olszewski here, and I want to thank the incredible women of Alpha Kappa Alpha for inviting me to join your community conversation. I wish I could be with you in person. I'm so grateful for the work that you do every day to uplift communities across the Baltimore region. Your AKA chapter is empowering women, promoting education, and advancing service and social justice at a time when we need you most. As a lifelong Baltimore County resident, former public school teacher and father, I come at this work not just as a public servant, but as a parent, husband, and neighbor who wants to see every American family thrive. That's why my priorities in Congress are simple. I will support any policy that creates opportunity for everyone, not just those at the top. I'm fighting to lower costs for working families, to create jobs, expand access to affordable childcare and attainable housing, and to address the looming healthcare crisis, because I believe that every Marylander deserves a fair shot at success. And I know the only way we get there is by doing what AKAs do best, showing up, serving others, and leading with purpose and compassion. Our progress as elected officials wouldn't be possible without the work that you all do on the front lines. So thank you again for inviting me to be part of this important conversation and for all that you do to make Baltimore County and our nation stronger.
We are truly grateful to him for his service and for sharing with us this evening. At this time, we're going to hear from Delegate Jennifer White Holland, and she's going to share how the Maryland General Assembly is standing up on behalf of Marylanders across our state. Delegate White Holland.
Thank you, Ms. Brown, and good evening, everyone. Thank you so much for hosting this timely virtual conversation. So also to quickly level set, as you may have heard from Ms. Ball, on October 1st, our federal government shut down due to our congressional lawmakers being in a budget deadlock. One of the primary drivers that led to this dispute is around the federal savings called enhanced premium tax credits. These tax credits have provided savings to Marylanders since 2021 and are now set to expire at the end of the year. Without these tax credits, insurance rates will go up significantly, and that will lead to significant consequences for everyone in our state and certainly our healthcare system as well. The more people we have insured, the lower the costs. If prices go up, though, people will drop their coverage, which means that our rates will go up. And so in Maryland, insurance companies anticipated that this would happen because Congress had not yet extended these tax credits when they were setting rates for 2026. And like the insurance companies, the Maryland General Assembly and state leadership also anticipated that this would happen. And so through Bill HB 1082, which I also had the pleasure of co-sponsoring, along with the chair of the Health and Government Operations Committee, Chair Pena Melnick, our state created a new subsidy program for everyone who is under 400% of the federal poverty level for 2026 through 2028. And this will help to reduce the costs of our plans on the Maryland Health Benefit Exchange. And so if Congress does not act before December 31st of this year to keep these premium tax credits in place, our state stands on the ready through the Maryland Insurance Administration and the Health Connection, or the Maryland Health Benefit Exchange, to adjust rates. The second takeaway that I would like to elevate has been around our public health infrastructure. As you all have heard, I am a trained public health professional, and I've also been on maternity leave. At this time, it has really been painful to watch how well-established science and evidence-based interventions have now been called into question. And we've also have seen our public health infrastructure be upended. And so there have been seeds of distrust, misinformation, disinformation, and it really has created a lot of confusion in our communities. But despite what we're seeing at the federal level, our legislature passed a bill that was led by Delegate Pam Gazzoni from Howard County that protects us from any cuts from the childhood immunization schedule and ensures that we have coverage of our immunizations through insurance with zero copay. So there is no prescription that's needed. There's no doctor's note that's needed, especially around these COVID boosters. And so for anyone wanting or needing immunizations, you can get one here in Maryland without a problem. And so as a new mom, my little one doesn't have all of her shots because of her age. She's not old enough yet. But because of this bill and the actions that our state has taken, I have some comfort in knowing that we're standing firm on well-established science for our communities to access the vaccines. And in Baltimore County, you can go to your local public health clinic and get your flu shot. There is no appointment necessary. And so all of these things, it's creating community immunity. In epidemiology, we call it herd immunity, but overall, it's community immunity that will keep babies like my daughter Riley safe, right? And all of us safe and healthy. And lastly, just for our conversation, it has also been painful to hear reports or even to witness our friends and neighbors being accosted by ICE agents, being detained and deported, despite being lawfully present and going through the appropriate process to become a U.S. citizen. And so locally, our police department does not partner with ICE through the 287G program, although it is active and there are agreements of this program in other jurisdictions. And so we've had community partners like CASA, Luminous, that's based in Howard County. They've partnered with organizations in our community, nonprofits, churches, hosting Know Your Rights trainings. And these trainings equip us with vital information. I've gone through 2 trainings thus far, and when we are out and about in community, if we see ICE, we can help our friends and neighbors to ensure that their rights are not being trampled on. And so there's a lot more that we have witnessed and are experiencing, and Maryland has also taken additional steps to make sure that we're meeting the needs for our federal workforce, and ensuring that they receive resources related to utilities and housing and so on and so forth, just to stand in the gap given what we have seen at that level. But again, we've seen a lot, we've witnessed a lot, but those are just a few of the highlights that I would like to raise for our discussion this evening.
Thank you so much, Delegate White Holland, for sharing with us the actions that have been taken on behalf of Marylanders. And we definitely appreciate the community immunity and also what we are doing to ensure we're combating all that's happening in our communities. Thank you so much. And we'll come back to you during our Q&A. Thank you. So now we're going to hear from Councilman Jones on what's happening locally in Baltimore County and what the priorities of the county council are. So Councilman Jones.
Well, thank you so much, Ms. Brown. I tell you, on the local level, I was reminded by Delegate Holland that, I remember when it was proposed that we participate in Proposition 287, something like 5 or 6 years ago. And I was very proud to stand strong and make sure that Baltimore County was not participating in Proposition 287, and the vote, fortunately or unfortunately, fell down along party lines, and we were able to prevent that from happening in Baltimore County. In Baltimore County, we are looking at somewhere around 13,000 federal employees in Baltimore County, which represents somewhere around 1 out of every 20. So we have a website that have various resources that I've placed the link in the chat. And it lists all the different things that we have in terms of career centers, things in the health department, things at our community college, various resources that we can provide to not just people that are displaced by the shutdown of the federal government, but also for other community members as well. Even though we live in a very difficult time right now, I'm reminded that we shall overcome as we have in the past. And I'm reminded that there are so many good people in our community, such as great organizations such as AKA, that is making a difference in our community each and every day. So despite seeing disruption like we've never seen in our history, despite watching all of our freedoms and so many things come under attack these days, I still remain confident that we're going to pull through it because of all the good works that are being done by so many good people in our community. So I'm here to answer any questions when we get to it. And thank you so much for having me. Thank you.
Thank you so much, Councilman Jones. We truly appreciate you and all that you're doing at the local level. We'll now hear from Holly Holliday, and she will share strategies for advocacy, engagement, and also share at a high level what is happening at the federal level.
Absolutely. Thank you. Thank you so much for having me, and greetings to the leadership of Epsilon, Epsilon, Omega. I knew I was going to mess that up. It is such a pleasure to be here with you. Well, the headlines with the federal government is really no surprise because it's shut down, as Delegate White Holland has shared. And unfortunately, we don't know when it will end because honestly, nobody's at work. And you can't end a crisis if nobody's actively working on the crisis. And so you're asking yourselves, well, what's happening during the time that nothing is happening. Well, one thing is happening, and that is that the attack on Black women continues to be pervasive. And this week we see it directed towards New York Attorney General Letitia James. Again, this is a baseless claim. I've heard some commentators say that this is thinner than Scott toilet tissue, one ply, in terms of this account. And we see, in fact, that many of the career prosecutors wouldn't even touch it. But the point is this: while our leadership at the federal level, well, luckily, mostly not our leadership, but as leadership at the federal level continues to disappoint us, we still have a role to play. And I would argue that, in fact, it is now when social activism is the most important. And let me understand, there are so many roles that we can play in social activism. And I just want to share a few with you because some of you may be saying to yourselves, Holly, I'm not a marcher. Holly, I'm not in office. No one will care about what I have to say. But activism looks like more than just protest. And there is so much that can be done, some of it invisible, quiet, but deeply strategic. And here's a list to make sure that you can find yourself somewhere. You can march, you can make flyers, you can manage data. I'm going to say that about 4 times. You can manage data. You can run networks or be a part of volunteering with C3, C4, C6 organizations, including our own beloved Alpha Kappa Alpha Sorority Incorporated and your Social Action Committee. You can moderate meetings or groups. You can run for office. You can also support people who are running for office. You can stay on calls until midnight, well, maybe just on Sundays. You can work through art, music, film, and storytelling. All of these creative measures are so important in making sure that every segment of our community understands what some of these issues are. You can organize mutual aid at a time when our resources from our government resources are being restricted and not serving the least of these. We might need to stand in the gap and feed families and hold space for healing. You can advocate through public policy, law, and legislative work. You can teach, write, research, or educate from the classroom to the grassroots, and I'm going to say to the treetops and every space in between. Some of us are showing up in the digital space, and let me just tell you, one place that we tend to over-index in terms of consumption of digital media. You all may be like me, we're constantly scrolling. We need a few more people who are also engaging, who are posting, who are creating content, and who are sharing information as well as scrolling so that our voices match our usage. Some of us are rooted in our faith-based organizations. We're mentoring youth, and we are standing for economic justice. And let's be honest, some of us, and we need these people more now than ever, are simply tending to our souls. They're simply taking care of and doing the emotional, spiritual, and care work that holds us all together. Here's one thing I know for sure. I've been in politics for over 30 years, and yes, I'm showing my age. But anger burns hot and out. Love, care, and joy endure. Thank you so much for having me.
Thank you so much, Ms. Holliday, for sharing such amazing words of wisdom and what we can do in this season. An entire list of how we can remain involved and really have an impact on all that is happening in our communities. Thank you so much, and we'll hear from you in just a bit in the Q&A also. We'll hear now from Dr. Katrina Debnam on public health in this time of challenges. How are folks to handle the mental health challenges that come with the challenges that we're all facing? Dr. Debnam?
Hi, everyone. Welcome. Thank you for having me. I bring greetings from as a proud member of Zeta Phi Beta Sorority Incorporated, and as a Baltimore native, born and raised there, and whose family still lives in the Baltimore County area. And so although my work has taken me to Virginia and Charlottesville and the University of Virginia, I am still very much committed to being supportive of all the activities and events and advocacy that's going on in the state of Maryland, specifically in Baltimore County. And so, I think one of the things that I wanted to start my remarks with was in my work, I see and observe and are seeing the impact of this year's events related policy and laws as an assault on public health, an assault on health equity, assault on our communities, and it's happening in so many ways that I think all of the panelists we could probably talk for hours about the ways that these things are playing out in our communities. A few of them that I think hit close to home for me and for probably many people on the call are in education. We're seeing pressures in academic higher education communities where to be withhold billions of dollars in federal funds that are both impacting international students and our students of color. We're being asked to to restrict the things that we are teaching in the classroom, which is an assault on our academic freedom. We're seeing reductions and cuts in all these safety net programs that many of the panelists have already talked about. So the nutritional assistance program, Medicaid, Medicare, that will have impact on us for years to come. We're seeing impacts and cuts on environmental policies. And so relaxed environmental regulations that are industries that are poisoning our communities every day. And then other cuts for other public, health programs like suicide prevention lines. I mentioned Medicaid already, HIV/AIDS clinics, mental health services. All of these agencies are experiencing cuts in their funding, which then limits the amount of resources and support that they can provide to our communities. One of the things that I was asked specifically to talk about is how do we take care of ourselves during this time? And one of the things that we talk about a lot in mental health and in public health is being emotionally aware of how you're feeling and being able to notice and label and interpret how your body is processing, specific emotional signals. And so being able to kind of label what you're experiencing. Is it anxiety? Is it nervousness? Is it sadness? And being able to create these correctly labeling your emotions helps you to kind of is the first step to being able to kind of manage the emotions so before they become too overwhelming. And so we talk about this and thinking about emotional regulation. And so this works this works for youth and it works for adults as well. And so being able to kind of be able to pay attention to the ways that that are you experiencing days of depression, days of anxiety, days of sadness that you may want to seek specific help for, and finding people around you that can be emotionally supportive. And so this is for you to both be able to support to them and them to be a support for you is to look for the signs, the changes in your body language, your behavior, and your tone and voice that are cues for challenging emotions. Look for people being around you being quiet and withdrawn, and sometimes even having lots of deep sighs and tearfulness. And to respond to that, show warmth and connection to them. What are the ways that you connect and build closeness with them, rather than correcting them or giving them too much space? Validating their emotions, saying, you really understand and how frustrating it may feel, and reflecting it back to them in a way that they can understand. All of these things really assist in problem solving for youth and for your friends and your family. Above all, be authentic. Let your genuine concern and curiosity guide the conversation. Be a support to them. Listen without judgment, so that they feel like they can trust you with what they're really experiencing and hearing. And know that sometimes you can't do this right away, but being able to come back to the person and connect with them and ask them to think about a little bit about what they're experiencing, how they can then de-escalate or move on from that moment is sometimes all we can do as friends in these trying and challenging times. And so I'm looking forward to the discussion part of this and being able to hear and answer and respond to your questions. And thank you for having me.
Thank you so much, Dr. Debnam, for sharing. And we truly want to ensure that we are, caring for community, caring for self, and ensuring that we have the public health lens front and forward and center at all times. I know, and I see that we have one question that has come forward relative to the importance of vaccinations. And I want to go back to Delegate White Holland, if you are available to take this question. How can we help as a community to spread the word about the importance of vaccines and vaccinations?
Absolutely. This is a great question, and I think right now it's important for us to elevate and to make sure that we're using trusted sources of information. And so, I would lean upon our professional medical organizations like the American Academy of Pediatrics, the American Academy of Family Physicians, our National Medical Association as well, and really encourage people to speak with your physician and share that information that you learn with others. Most importantly, I would also say that it's important to share your own story. There is power in telling your story and your personal experience, maybe with a vaccination that you might have received early on in your encounter with an infectious disease that now has been eradicated, right? And so, as we're seeing these outbreaks that are happening, or we're learning more about these outbreaks that do happen, it's important that we use trusted sources of information, but that we also tell our own stories and make sure that if we are disseminating that information, that it's rooted in fact and certainly well-established science. So those are just a few things that I would highlight.
Thank you so much for answering that question. We appreciate you and your expertise. I saw a question that came forward, and I'll take this over to Councilman Jones relative to those who are living locally, who are impacted by what's happening and may live on a fixed income. What are the possible ways that they can seek out resources, and what can they do at a local level?
Yes, on the local level, first of all, I sent a resource as a link in the chat, and that has a lot of information there. Depending on the issue that the person is suffering from, I think most banks and creditors are making adjustments to help people. I was online the other day to pay a bill, and the first thing popped up. They wanted to know, was I affected by the government shutdown? So I think there are a lot of resources available to help people. And I think what you have to do is just reach out and try to find some of the information that is there. Like I said, the webpage that I gave is very helpful, but there are also other places where you can get assistance throughout our community, whether it be libraries, community college, you name it. So thank you very much.
Thank you so much. And I'll go next to Ms. Holliday relative to the government shutdown, because this really is front and center for so many people in the community. And I would just ask, from the last government shutdown, I know that things are different now, but what are some lessons that we can learn, and how should folks really look to proceed in navigating these uncharted waters?
Oh boy, that's a good question. And listen, let's level set this here. And let me adjust people's expectations. No, you are not insane. No, you are not crazy. This government shutdown is not like our previous one. The previous one, which lasted 35 days, also under this president, was different than where we are now. One way it was different, Congress was actively engaged and working to try to seek solution. They were still fighting, they were still not agreeing, but they were communicating with each other. That's one thing that's really different. Let's assume also that we are not in normal times, so normal rules do not apply. We have seen this administration do things that are beyond unorthodox, and many would say borderline, if not actually illegal. So you may have heard things, depending on which agency you're affiliated with, that they're not going to pay back pay for you being off work. You may have also, you may be uncertain about when you may be able to go back to work. There are a lot of things that are happening that are not in the normal course of business. So, what can you do and what should you be doing in this time? Well, I would start first, as was shared earlier, be aware and be conscientious of your mental health. This is a situation where we don't have a lot of answers. That is true, but it doesn't mean that you don't have control over what you're doing and what you decide to do. So be engaged in your community. Take this time to really invest in your own mental health, for one. Number two, the other thing that we've been recommending is stay engaged with other federal workers. Some of you may, in fact, be parts of unions. That's an excellent source of information. They have their hands on the pulse of what's happening. You may also be involved with affinity groups. Stay connected and stay engaged with each other. We get to break out those COVID skills again and use our chats and use our virtual functions to stay connected to other federal workers who are similarly situated. And then finally, I would say find your political home. Find the place where you can exercise social activism, where you can be engaged in mutual aid, where you can add value and make a difference. And so I think all of those things will be helpful.
Thank you so much. I appreciate your words of wisdom and your expertise. And I see that there are a few questions in the chat, and I will yield first for Delegate White Holland. Oh, I see the answer. Yes, so if you want to answer that live, and I'm going to answer the question in the chat about the state program for federal workers.
Yes, of course. So the bill that extends subsidies, or that created our own state subsidy um, to ensure that our plans in our state could be more economical from 2026 to 2028 for those 400% below the federal poverty level. It was HB 1082. Again, that's HB 1082 in the House.
Thank you so much for answering that question. And so I just want to make sure that we've answered all the questions that we had in the queue relative to the question for a state program for federal workers who are working unpaid through the shutdown. Are there programs at the local, state, or federal level for furloughed workers who are not working? And so shared a resource here relative to the state of Maryland and those who are at the federal level. So hopefully this is a resource for you, and we will collate resources and share them post-call also so that everyone has these resources. So if we don't have any additional questions at this time, we just want to thank those who are with us. Oh, I see Councilman Jones. Want to make sure I see your hand. Was there something else that you wanted to share? I will yield to you.
Yes, thank you. I just wanted to add one thing. I saw a news report the other day that so many people were resigning. And what I would say is, number one, to the employees that are laid off, that are going through this, number one, I stand with you. And we will, I've been protesting all around this county, standing with you. But what I want to say is, don't panic, right? Talk to your union, talk to sources that you can trust. Don't panic and get caught up in a rhetoric that is coming out of DC in terms of laying people off and things of that nature, because I know that some people are really, they're really stressed out. They feel like they need to quit before they be laid off. But what I'm asking you to do is just be very thoughtful in making these very important decisions. And it starts by getting good information from your union and people that you can trust, and not from the news. So that was it.
Thank you so much. And truly appreciate Senator Hettleman for being with us. And if you want to come on now and share with us how folks can be engaged at the local level and priorities that you have, just share just a few minutes with us. Again, we know that you were teaching, so we're so grateful that you're able to share with us.
Thank you so much. Good evening, everybody. I'm sorry I'm late. I'm in an empty classroom right now down at University of Baltimore Law School. I co-teach a class on legislation, and so we've had some really interesting bills proposed by our students. What they have to do is think of an issue and a problem and draft a bill and amend it and present it to the class as if it were a committee, and then write a memo detailing, using everything they've learned over the semester, how they're going to get the bill passed. And the reason I actually went through that with you is because that is one way that you can get involved and you can be empowered to address the myriad of issues that are before us today. And I'm sorry I didn't get to hear my colleagues. I know Delegate White Holland is on and Councilman Jones. I just caught the tail end, but and others on this distinguished panel, but there's no shortage of issues that we are all facing right now, certainly from the federal administration. And I don't know the exact nature of what you discussed, but I know one of the issues that you all care about is mental health. And, certainly things that are coming down from the federal government are really concerning right now. Changes in Medicaid, the administrative burden that we're going to be putting on people in 2027 are very concerning to, I know, the provision of service delivery to people who need mental health services, whether it is substance use issues or whether it is social and emotional issues, and people need counseling. And that is something that I think is very, very important for us to be able to provide, to support through our crisis centers, to be able to support the providers, to be able to accommodate, to get enough providers to provide the services that our citizens in Maryland need. And that is something that I know I will continue to work on in the legislative session coming up. And certainly one of the issues that you can be involved with. It's legislative action makes change and it helps people through statute, and your advocacy is really, really important. I tell people ask me all the time, like, does it really make a difference if I call your office or if I write your office and express an opinion about a piece of legislation? And I always tell people it absolutely does. If you're a constituent, please be in touch with our office. Tell us what you are experiencing. If there's a problem, an issue with a state agency, you can be part of the solution too. One of the bills I had worked on last session in the past was about a lawyer, happened to be a lawyer who got scammed. He got scammed from a cryptocurrency machine. And we passed a law to change that. And that was because, and he was really embarrassed about it. But he said, the money that I lost is not going to change my life, but so many people are getting scammed out of so much money that can make a real difference in their lives and really horribly impact them, that I want to help people. And we did it. So you can make a difference. You can stand up to the bully down the road a piece and be part of the effort to push back and to change and to make your voice heard. So I don't want to take too much time. I can't see everybody who is participating here, but I'm happy to answer any questions. And I am thrilled to have been included here and honored to really have a chance to talk to you all.
Thank you so
Thanks.
much for sharing. Thank you so much for.
And I know, let me say one other thing.
Yeah.
I know that Alpha Kappa Alpha you have such a history and a really a duty, I think, imbued in the organization to give back to the community. And so I know so many of you are so involved in so many important issues in the community. And you're here also 60 some of you are participating here. And so you already are so involved and are activists, and just share your experiences and your activism with friends and family.
Thank you so much, and it's an honor for you to be with us, and it's an honor for us to have you. And we abide by service to all mankind, so we appreciate you, and it's an honor to serve. Thank you.
Thank you.
So I see one more question in the chat, and truly this has been such a robust discussion this evening, and I want to make sure that I'm getting to the last question that we see. It's relative to, let me see, Brooke McCauley shares, I've heard that there are groups exploring withholding their federal taxes until Congress returns. How likely is it that we could actually do this as a mainstream strategy to get them back in office? I'm going to ask Ms. Holliday to share her thoughts on this question as we wind down.
Well, my first disclaimer is going to be, far be it from me to suggest to people how they choose to show up in protest. But I would caution this. Just because we're in a moment where it feels as though the government is doing unjust things for you, to you, and it in fact is unjust, does not then change the law or the rules about what is expected from us as individual people, citizens, or organizations. So when you decide to do these things in any protest situation, be aware of the pros and the cons, and specifically the risk. And I want to caution you around taxes because, as I mentioned earlier, a lot, especially if you are a Black woman or a person who is in a minority class, because this is an administration that is not above retaliation. They have, and the IRS is one of the spaces that they have asked for people to be investigated. We've already seen actually a whole executive order go out specifically targeting individual organizations that were believed to be in opposition to ideas supported by the president or supported by other groups that the administration is appearing to be in affiliation with. So you got to be really, really careful about some of these strategies. They may have some risk involved that may be higher than what you want to pay. I would just say, I'm not saying don't do anything, but I am saying be very careful about what the risk is. Here's some things that I think have a little bit lower risk, but have a higher level of productivity in terms of protest. And it all starts with being a part of a tribe, be a part of a collective, join organizations and groups and movements that you believe in that are speaking to the issues that you find to be most important, and push the boundaries of civil engagement. Those are places where you have protections, where you have laws, where you have well-established precedences. There are other things that you should do. And I know some of you are thinking, Holly, these are not normal times. We can't just do normal protest things. Well, yes, we should certainly be creative. And this is why even in the things that I thought that I shared with you of what we could do, we need to be creative in invoking ways to reach more people. We have been, I think the former vice president has used the word that we weren't expecting folks to have the level of capitulation that we see. Democracy in this country is still governed by the people. I will share with you candidly, the people have more power than we think, but it requires us to have a united or collective front. The best thing we can do is to get more people involved, get more people engaged, and demanding the things that we think are important, like protecting our health care, like ensuring that we have the social programs, the safety net programs that we need, like Medicare and Social Security, and other things that you think are important. Make sure that you find the other folks that think it's important and go together. I hope that's helpful.
It absolutely is, and we appreciate you. Thank you so much for answering that final question, and we appreciate everyone for being a part of the conversation. I see one additional question relative to ICE and what we're going to do. CASA, as Delegate Jennifer White Holland shared, has been really leading relative to these efforts, and we can ensure that we share that post-event. But there is a CASA ICE raid tip line where you're able to report activity that is happening. That number is 1-888-214-6016. I'll say it again. It's 1-888-214-6016. And you can visit https //wearecasa.org/no-your-rights/. So we'll ensure that we send that out. We'll also share from Ms. Holliday a Know Your Rights toolkit also. So we'll have a number of resources that we're going to be sharing with you. So appreciate all of our panelists just for being so engaged and for sharing information with us. And Dr. Debnam, we appreciate you also relative to the mental health resources and how you as a public health expert can ensure that we are able to care for self and also care for others. Ms. Holliday, we appreciate you. Senator Hettleman, thank you so much. Councilman Jones, thank you. Delegate White Holland, thank you so much, everyone, for being a part of our conversation. And we are going to, again, share information post our session. We have all of your email addresses. So we're going to be sharing with you all so that you can have the resources. And I just want to underscore one thing that Ms. Holliday was sharing as we have just a few slides to show what Alpha Kappa Alpha is doing to ensure that we are really ensuring we're soaring to the polls. We want everyone to know that your voice is your vote. So we want to encourage you to ensure you register to vote. There's a QR code that is there. We have joined with When We All Vote to ensure that we are empowering individuals to check their vote ready status, right? Check to make sure that you are register, that you know where your polling center is, and take someone with you to the polls as they have shared this evening. We also have a election protection hotline, 866-OUR-VOTE, that you can call should you see something that you don't think is quite right at the polling center on voting day or leading up to voting day. So this is a resource that we have through our sorority, also in partnership with other organizations. And we have one final slide where we want to just ensure that everyone is making their voting plan. We're soaring to the polls, and make sure that you have your voting plan, that you are taking someone with you, that you know what your polling place is, right? That you know what you need to take with you. And so with that, we appreciate you for being on with us. We are going to have our first Vice President, Ms. Jerome Avoid, share a bit of our upcoming programming, and then we're going to close out right at 8 o'clock. So thank you everyone for being a part of our session this evening. Ms. Boyd?
Yes, thank you so much, Kendra, and thank you all for a wonderful conversation this evening. One of the things that we strive to do in the chapter is to make an impact in our community. And as the program chairman, I do have the oversight of our community programs, reaching across different sectors from churches, schools, community organizations. So we just appreciate the opportunity to serve, right? That is what we're here for. So with that, I just want to encourage everyone to continue to look at our website, follow us on social media. We do have a few upcoming events that may be of interest to you, including our Precious Pearl Cotillion information sessions, as well as we do have a few other like fundraising events coming up. But we are engaged in the community, and we just appreciate your engagement today. And of course, if we can be of service to you or in any way, you can reach out to us through our website. Our contact information is there. Thank you again for this opportunity.